Do you have heel pain first thing in the morning, or maybe after being on your feet all day, or even during a run? Almost like the more you're on your feet, the worse the pain gets. Now, these are symptoms of plantar fasciitis, and it can be a beast. My treatment for plantar fasciitis has changed a lot over the years, and now it's a lot more efficient and faster with better results. And that's what I'm going to be sharing with you today. So let's dive in. Well, hey there, runner. It's Dr. Lisa, your host for the Rehab for Runners podcast, and I'm so excited you're here because we're going to be talking all about plantar fasciitis. And if you've ever had plantar fasciitis, you know how painful it really can be. I've had plantar fasciitis. It was not from running. It was actually from working and being in the wrong pair of shoes. So I had plantar fasciitis 8 years ago. And this was when I was working as a PT tech. So I was waiting to see if I got into grad school. And I was wearing those famous Dansko shoes that everyone recommended, especially if you're on your feet all day. I bought them, they were expensive, and I said, well, I need a good pair of shoes if I'm gonna be on my feet for 12 hours a day, because those were the shifts, that was the shift I worked. And about 2 weeks into my job, I started getting a ton of heel pain at the end of the shift. And then into the morning, right when I'd wake up, the first couple steps out of bed were awful. They were awful. And you know this if you've had plantar fasciitis, but I just know I've been there, and I can't wait to tell you more about how to treat it and how the heck to get rid of it and kick it so you can get back to running without pain. Plantar fasciitis is very, very common, and one question that I always get asked is how long until it goes away? And just like with any injury, it depends first, but also it depends a lot on what you're doing to treat this injury. Because if you're just, resting it, laying in bed, or just sitting on the couch and not necessarily exercising, it's not necessarily going to go away. Now, it might decrease, and then the second you start running again or exercising again, it might come back because you haven't actually addressed the source of the pain. You've probably just decreased the inflammation going on. So that's going to result in less pain, but you still haven't addressed the source of the pain. So it really depends how fast you can get your hands on the right treatment strategy for you that's going to get rid of the pain and not just put a Band-Aid on the pain, not just kind of mask the pain and then 2 days later the pain comes back. And we'll talk about treatment options and ones that work really well for plantar fasciitis and ones that are just worth skipping. But let's dive in first to how my treatment plan has changed when treating plantar fasciitis. When I was a new grad, I would see a ton of plantar fasciitis, and really it's a common injury for not only runners, but those who are on their feet all day. And my treatment would start, and maybe you've been to a PT in person and you can relate to some of these, but I would do some scraping with like a Graston tool, which is that metal tool. And you put some lotion on your heel and then you start scraping to try to get rid of, quote, scar tissue, or to try to loosen up the plantar fascia. I also had my patients rolling their arch like with a lacrosse ball. And I did recommend night splints back then. Now back then is like 4 years ago, but I did recommend night splints for some of my patients, but I'll talk about night splints later. I would also have them stretch their calves, good old static stretching. I would encourage orthotics. I would stretch the big toe, and for manual therapy, along with scraping, I would massage the arch. Now, this helped patients a little bit, but it wasn't like it took the pain away and they were good to go. It really just decreased the pain just a little bit. Now, that's all I knew back then. It's what I learned from my mentors. All my mentors would say plantar fasciitis is very difficult to treat, and that just kind of stuck in my head. So I would just go off of the treatment that they did because I didn't know any better. I was a new grad. But now that I know a little bit more and I'm diving more in the research, my treatment plan has changed significantly, and being able to treat plantar fasciitis is something that I feel more confident in, and I feel like I can treat plantar fasciitis a lot faster now, which is really cool because, again, I've been there and I know how painful it can really be. So now my treatment plan works and addresses the big toe, the calves, the arch, the midfoot, rear foot, and forefoot stability, and looking at running form. And these new methods, I guess you could say, work because, one, I'm not, quote, putting a Band-Aid on the injury. So like massaging the arch or scraping the arch is not fixing why the pain is coming on. If we think about plantar fasciitis, you usually have pain right where the plantar fascia inserts into the calcaneus, so into the heel bone. It's one of those injuries where you could press your thumb into the heel and you want to jump off the table because it hurts so bad. That's a pretty good sign you have plantar fasciitis. Now, I'm not diagnosing you. I'm just saying it's a pretty good sign you have plantar fasciitis. Now, the reason that there's inflammation where the plantar fascia meets the arch is because there's too much load or force into that area. And over time, these compensations from the foot and ankle have just caused more and more load through that area. So if I'm trying to reduce the load in that area, and massaging the arch and massaging, the calves even, and massaging the plantar fascia is not going to take away the pain. That is not why the pain is coming on. The pain's not coming on because the calves are tight or the plantar fascia is tight. The pain's coming on because there's too much load going through where the plantar fascia inserts on the calcaneus or the heel bone. And that's usually because of the big toe not working correctly, the instability going on in the arch, and the calves being tight. And because of those compensations, there's now too much load. So if I think about my treatment 4 years ago where I'm stretching the big toe, okay, yeah, that was probably one of the best things that I did. Massaging the arch, okay, that probably didn't, it probably felt like a this hurts so good sort of sensation for the patient. But 2 days later, they're having, pretty much the same amount of pain. So that obviously didn't help. Stretching the calves was a rookie mistake because they're probably tight because they were weak. And rolling the arch, again, I'm just trying to stretch out the plantar fascia, but that's not necessarily the reason that the pain is coming on. If I'm talking about running form, then in addressing the running form, what's happening when you're running, usually someone with plantar fasciitis is a heel striker, which if you know me, there's nothing wrong with being a heel striker, but they're probably overstriding a little bit to where all the load is going through that one part of the heel, and they're not able to stabilize the foot once the foot hits the ground. And because of that increase in load, when you're overstriding, it's just repetition after repetition, the pain's gonna get worse because now it's more load through that area as you're running more miles, and now there's more of that inflammatory response. So we gotta fix that. So let's talk about why my new method to treating plantar fasciitis works. And this is a general treatment plan. Obviously, plantar fasciitis can be very different for everyone. You can also have issues at the knee and at the hip that need to be addressed, but I'm talking about more general plantar fasciitis and why these methods work. So if I'm looking at common movement patterns for those with plantar fasciitis, there's 5 that come to me. So if I'm looking at common movement patterns for plantar fasciitis, there's 5 that come to me fairly quickly, and these are very, very, very common movement patterns. So this means like if someone presents to me with plantar fasciitis, majority of the time, now not always, but majority of the time, they are at least showing 3 of these 5 signs. So the first sign is lack of big toe mobility and stability. Now the big toe, I did a podcast episode on this, so if you're like, why is the big toe important? Make sure you go back to that podcast episode because is very important, but the big toe has to stabilize when the foot hits the ground. But as you push off, it also has to go through that mobility for push off with gait, with running. So if the big toe is not able to stabilize, and the big toe, once it stabilizes, the foot hits the ground, the big toe is pushing into the ground, that triggers the arch to now stabilize and the posterior tib to now activate. So if it's definitely a cause and effect or a ricochet effect. So if the big toe is not able to stabilize and tell the arch to stabilize and control, and then the posterior tib to work, those other things, the arch control and the posterior tib not working, it's out the window because the big toe is not stabilizing. So being able to stretch out that big toe into specifically big toe extension, where you bring your toe up, or closed chain big toe extension where you're pushing off the ground, and being able to stabilize it. 9.9 times out of 10, someone with plantar fasciitis does not have enough big toe mobility, and they are not able to stabilize the big toe, specifically in a single leg position. Number 2 is lack of arch control. So again, because the big toe triggers arch stability, you're not going to have that arch stability. The arch, specifically the midfoot to the rear foot and then the midfoot to the forefoot, is very unstable. And again, that's why all of that force is going through that one part of your heel, your arch. So if you need to have that arch stability, you need to work on these foot intrinsic muscles that sit under the plantar fascia, which there's like 5 layers of them. It's insane because they're very small, but they're very, very important with foot stability and arch stability. So being able to work on those muscles, being able to activate them, stabilize the foot so it's not all going through the heel. Next is the weak calves that appear tight. Now, again, the rookie mistake was stretching the calves. I didn't really know better, but if you are static stretching your calves, you're not addressing why they are actually tight. Even if you hold it for 2 minutes straight, you're still gonna have that tightness 2 days later, I guarantee it. So we have to work on the strength of our calves, specifically into a single leg position. So working on your calf strength with your knee straight and your knee bent is a great place to start. And then also double whammy, because if you're working on single leg heel raise, your big toe has to push into the ground when your heel is up in that single leg heel raise position. So that's why I love single leg heel raises. Now for running, I already stated that you're overstriding, very, very common. You might also, if you're having a ton of pain, you might also have an antalgic gait, which just means it looks like you're running with pain. Basically, you might be taking shorter steps, trying to change your foot strike. You might be just basically trying to avoid any load or force through your heel, because that's where the pain is, that's where the inflammation is. Your body's like, how can I continue to run without putting all this force and load through this one spot that is killing me? So you might even try to land more on the outside of your foot, or just any compensation so you're not putting so much load and force through that one area. And the last movement pattern that I see all the time is a very stiff ankle. Now this goes, if you think about it, this really goes hand in hand with having all that load go through the plantar fascia insertion, because if your foot is hitting the ground without any give, or you're not able to disperse the shock, you're probably landing very loud, but also your foot is just hitting and your heel is just hitting where the plantar fascia inserts. And instead of it being like a smooth rocker foot, you're just loading all that force onto where the plantar fascia inserts. And again, usually we see more stiffness into dorsiflexion compared to plantar flexion. So being able to go through that dorsiflexion range of motion and absorb the shock is very important. Now let's talk about rehab options, because this is one of those injuries that has like 10 rehab options that I've seen and heard of. And let's go through if they are even worth trying, because some of them can be very expensive and I don't want you to waste your time or your money. So the first rehab option is a massage. You might get a full body massage, and you might want it to really emphasize like foot and ankles tightness. And the masseuse might say you have very tight calves and very tight plantar fascia. Now, again, we already talked about this, but about why it's tight, but it's not, it might feel good. You might feel better after the massage. And if you want to keep doing it, go ahead and keep doing it, but it's not addressing why the pain is coming on. And again, it's not addressing how your foot is absorbing shock. It's not addressing the big toe mobility and the stability of it. So that's why you don't have to get a massage. You don't have to get a massage for pretty much any injury, but if it helps reduce your pain in that moment, and you want to do it, then that's up to you. I'm just giving you my recommendation. The next rehab option is dry needling. Now, I really like dry needling, and if you have plantar fascia, then you might want to dry needle or get, don't do it yourself, but you might want to get your calves and your plantar fascia dry needled. I will say, if you get your plantar fascia dry needled, just bite your tongue, because it's going to be a little intense. But your calves, they're going to be tight, so they might feel a little bit better when they get dry needled. But again, you're just releasing the muscle. You're just releasing it's basically when you insert a needle into your body, a dry needle specifically, you're eliciting a muscle twitch so the muscle can relax. So you're not strengthening the muscle like we want to, you're just helping it relax. So if this helps with pain management, go for it, but follow it up with exercises. Do not just dry needle. Your pain is gonna come back. If your PT just has you dry needling, you have to follow it up. Say, what are some exercises that I can do? Because that's just not enough. It's not enough. Number 3, okay, if your PT does this or your chiro does this, run. You're wasting all your money. And that is laser treatment or ultrasound. Now, if you do see benefit to this, chances are it's placebo. A lot of clinics don't even use laser anymore because insurance doesn't even reimburse it, because it's just that much of a waste of time and money.